The current C-section rate from 2021 is 32.1%, yet the recommended rate is between 10 to 15% for optimal health. I'm Annabelle Carney, childbirth educator and physician assistant, and I love helping mamas just like you have a better birth experience. So if you're new to my channel, thank you so much for stopping by, and don't forget to hit that subscribe button and ding the little bell down below so you don't miss any future videos. So the most common reason for cesarean is what's called failure to progress, followed by non-reassuring fetal heart rate tracings. And in this video, I want to talk about failure to progress and give you some tips on how to avoid an unnecessary cesarean. Failure to progress is actually an outdated term that basically described lack of progressive cervical dilation or descent of baby within the pelvis. And updated research now recommends not using that term, failure to progress, but instead to be more specific by diagnosing mama with either first stage of labor arrest or second stage labor arrest. ACOG's new guideline specifically defines each stage of labor arrest to prevent unnecessary cesareans, and you can click the link below to read more. So in all reality, failure to progress is when the healthcare provider states that labor is not progressing as quickly as they think it should be, which to me is extremely subjective and can greatly impact your birthing experience. Now, maybe you heard that you should be dilating 1 centimeter per hour, but that's definitely not true. So where did this come from? So let's bring it back to the 1950s where Friedman's curve was born, and this graph gave providers an understanding of the average labor duration and continues to impact childbirth practices today. Dr. Friedman conducted a study on 500 full-term patients in a New York City hospital, and the purpose of this study was to define the time that it takes to dilate by centimeters during labor. He found that the average time for first-time mamas to go from 0 to 4 centimeters was 8.6 hours, and that once a woman hit active labor, defined back then as 4 centimeters, their labor sped up to dilate an average of 1 to 3 centimeters per hour. Now, of these women, the average pushing phase was 1 hour. But I really don't think that this study can be applied to modern maternity for many reasons, and I'm sure other birth workers can agree. First off, it's important to look at the demographics of the study because Friedman only studied white women due to the racial segregation that was prevailing in the hospitals at the time. Additionally, 96% of mamas in the study had some level of sedation, especially since twilight sleep was still a practice being used. So sedation may have substantially sped up labor. Also, more than half of the women had forceps-assisted births, which skews the whole laboring time as they often pulled babies out when they're still high up in the pelvis. And lastly, I just want to point out that none of the women in the study had an epidural, as it was not a common practice. And today, roughly 70% of women receive an epidural for birth, which we know actually slows down labor. So although at the time Friedman's curve was such an innovative study and the gold standard, it didn't measure normal physiological birth, and birth practices have also changed dramatically since 1954, thus should not be used to assess the progress of laboring women today. So I want you to remember that a labor taking longer than expected is not an indication for surgery, and just because the clock is ticking faster than she is dilating is not a reason for a C-section, especially if mama and baby are stable. So there are a lot of different factors that can impact the length of labor, and in my course, The Natural Birth Blueprint, I go in depth about what you need to know for the smoothest birth possible and how to address any labor stalls in the event this situation arises. So if you're an expecting mama with a goal of having an unmedicated birth, click the link in the description box for more info. So here are 3 common reasons why your labor has slowed down and tips for you so you can avoid an unnecessary cesarean. The first reason is your care provider. Whether you have an OB or a midwife, labor requires tons of patience. And some doctors and midwives have yet to adopt the new guidelines for labor arrest, leading to a greater chance of being misdiagnosed with failure to progress, resulting in a C-section. And some providers recommend an induction for non-evidence-based reasons such as a big baby, or that your pelvis is too small, or simply out of convenience for them. A study in 2003 actually found that labor induction was associated with an increased risk for cesarean from 13.7% to 24.7%. So I highly suggest that you are picky about who you have as your provider because they greatly impact your overall birth experience. So during one of your prenatal appointments, ask about their induction and cesarean rates, or ask about the types of scenarios that would warrant an induction. Overall, just make sure that you choose a provider who aligns with your values and makes you feel comfortable talking to them. And I'll also link my video about informed consent right over here to help you advocate for yourself in this type of conversation. The second reason is your environment. So the process of childbirth is a highly intricate physiological event and is facilitated by a very delicate dance of labor hormones from start to finish. So for instance, when a mama feels observed or uncomfortable, her body responds by releasing adrenaline, which can hinder the flow of oxytocin, which then prevents her from having contractions and dilating further. Also, in environments with bright lights and noise like the hospital, the release of melatonin actually slows down, and melatonin and oxytocin work together. So a decrease in melatonin levels translates to reduced oxytocin levels and potentially leading to a lengthier labor. So if your labor slowed down, take a minute to reevaluate your environment. What's bringing you stress? What's making you feel anxious? Is there someone in your birthing space that makes you feel uncomfortable? Just ask them to leave. Or if it's too bright and the lights can't be dimmed, try using an eye mask. And the third reason is a lack of movement. Arriving to the hospital and going straight to the bed and being connected to an IV and monitoring equipment can significantly limit your ability to move. And babies work with the space that they're given, and restricted movement can cause labor to stall or even lead you to push for hours. So remember to maintain mobility during labor to help baby navigate their way down through the pelvis. I equip all my birth clients with what they need to know and teach them exactly how to achieve a natural birth. So if you are planning to go unmedicated and would like some support along the way, click the link below and DM me on Instagram. So remember, although there are certain cases where C-sections are absolutely life-saving, they're frequently employed without true necessity. But whatever your decision is, my hope for you is that you make an informed decision for you and your baby. I hope this video was helpful for you and provided you with some insight to the concept of failure to progress, known as labor arrest, and ways to avoid an unnecessary C-section. Don't forget to subscribe to my channel and follow me on Instagram at AnnabelleJoy. I'll see you in the next video.